Assalamu alaikum, my dear friend. I'm Hinde Iraqi from Morocco, and I am an endocrinologist in Rabat. I'm going to present you today the healthcare professional perspective in French-speaking Africa. We called it the diabetes study. We did it last year. What is this study? It is about the knowledge and practice in diabetes management during fasting in Ramadan of 2022, by healthcare professionals from French-speaking African countries. Why we did this study? To see if we have an impact in our healthcare professional through the different conferences, especially the Francophone one we did the last 2 years, and of course to see if they follow a guideline. So please don't miss, if you are Francophone, the DAR Francophone 2023. When we go through the guidelines, then we see that one of the targets is to reach the healthcare professional, the diabetes team, etc., and that they could have focused diabetes education. So I already told you the aim of the study. We have healthcare professionals like GPs, pharmacists, specialist doctor, and we were asking about their knowledge regarding diabetes and Ramadan fasting. It is a cross-sectional design study with the questionnaire, 25 questions, very quick to go through, 5 to 6 minutes on Google Form. And we administer it before Ramadan 2022. We have 2 parts in the study, general question and 14 questions about the knowledge and the practice. Then the participants had the link to see again the DAR 22 Francophone meeting. In our population, we have 1,269 healthcare professionals. As you can see, there is a Gaussian distribution with an average age of 46 years old. And when we do the statistics about who was attending the seminar the last 3 years, then we can see that the youngest one, less than 60 years old, were more keen on attending seminar than the doctors and all other healthcare professionals who were more than 60 years old. I'm Moroccan. It was easier for me to reach more healthcare professionals. So Morocco was 43%, almost 44% of all the study population. And then we have the Maghreb with Algeria and Tunisia and the other French-speaking African country. So we can say that 18% of the healthcare professionals were from the Maghreb countries with the Morocco, Algeria, Tunisia, and Mauritania. These healthcare professionals were mainly GPs, and then we have endocrinologists and the other specialty or pharmacists. 68% of the population attend the seminar, and they had, most of them, they attend less than 4 times in the last 3 years. We had a question about the fact if they were comfortable providing care to patients who were fasting Ramadan. And as you see, most of them agree or strongly agree. We have 70% of them who were comfortable with care in diabetes during Ramadan. Half of the population had follow international guidelines, and a quarter follow local guidelines. And then we have questions about what they do with their diabetic patients. If they advise them to consult about the risk of complication before each Ramadan, if they monitor their blood glucose more, and if they always have 3 meals a day. Of course, if you go to the recommendation, we have all the answer, and of course they should say yes for the 3 questions, and also about the monitoring of blood sugar level that is more frequent usually than before Ramadan. And also the dietary advice were in the recommendation. So here, please focus on the question. We can see that there was a statistical positivity if they attended the webinars in Ramadan, then they were more keen on saying yes to advise the patient to consult. Also, for advice of monitoring blood glucose level in the fasting days more frequently, it was also statistically significant in the people who, healthcare professionals who attend the webinar the last 3 years. So we should ask all the healthcare professionals to attend webinars on Ramadan to have more advice. And also about 3 questions about who should break the fast. According to glucose monitoring, less than 70 milligram per deciliter in the beginning of the fasting or in the afternoon, or if it exceeds 300 milligram per deciliter. You have also the advice proposed in the recommendation, and this time too, the doctors and the healthcare professionals who attend the webinars were more keen on advising patients to break the fast at the right moment, less than 70 milligram per milliliter or more than 300 milligram per deciliter. So for the last question about who should break the fast, if they have symptoms of hypos or if the glycemia was less than 0.7 gram per liter, it was the same. So as you see, it was always very significant. We asked them about a clinical case of one type 2 diabetic patient who would be on maximal oral therapy or in GLP-1 receptor agonist, who would consult 2 weeks before Ramadan, and his A1C would be very high, more than 11%, and he's going to fast. We insist to say that there is no right or wrong question, just to see if what they would do. And as you can see, 72% of the healthcare professional would advise the patient not to fast due to medical reasons, especially hyperglycemia. And then we had 14% who would accept the opinion and then change to insulin for better control. And the 14% of the healthcare professional who would also accept the opinion and would not change the medication, but increase their diabetes monitoring over the next week. So the key learning of our database study is that we should do more education, more webinars, more clinical cases for all the healthcare professionals, because having attended conferences on diabetes and Ramadan was significant when it came to good practice. And also, we should sensibilize more to attend the DAR Francophone meeting, because it is our recommendation, and it would be interesting to have the same messages for the patient. And of course, we expect to do other studies with the Francophone country, and we would be very happy to have more representation of all the countries and of more healthcare professionals. And of course, all my thanks to all the doctors, healthcare professionals who did the study. Special thank for Mohamed Hassanain, my friend, for his support, and my dear colleague Kautar from Morocco, and all my friends from the different countries, Morocco, Algeria, Tunisia, Senegal, Cameroon, etc., to have spread the link for their healthcare professional. Thank you very much, and Ramadan Kareem.